The attorney generals of 33 states are suing Meta, alleging Instagram causes harm to its young users.
Meta knew that its platforms were unsafe for young users, yet Meta continued to claim that its products were safe and appropriate for children and teens.
The states claim addictive features like infinite news feeds and frequent notifications are contributing to the country's mental health crisis. Their lawsuit marks the latest attempt by states to rein in tech platforms over fears they are fueling a spike in youth depression and suicidal ideation. For more on this, I want to bring in our Canada Tonight's medical contributor, Dr. Samir Gupta. We've reached him in Toronto. Dr. Gupta, I've heard you talk lots about too much screen time and the effect of social media on adults, teenagers, but what do you make of these U.S. states now suing Meta?
Yeah, Sarah, you know, it's interesting with the drug analogy that was mentioned there. If you look at the opioid crisis, we had companies that were producing highly addictive substances. They had internal data that they didn't share with regulators or physicians in terms of how addictive those substances were, and ultimately they used that to their advantage to create a whole population of people who were addicted, and many of whom suffered and died, and ultimately they faced lawsuits for that and were condemned for that and found to be guilty. And so some of the parallels that are being drawn are that these companies are allowing young people to create accounts and to use their products. And again, you know, in the US, if you're under 13, you shouldn't be even allowed to create an IG or Facebook account, but the barriers to doing that are not very high. So they're being accused of allowing that to happen, but then also taking that information and gamifying their apps so that it's even more attractive and more addictive to those very young people. And similar to the opioid story, we're getting some of the information about how addictive and harmful it is through leaks. You know, they have their own internal data, and there was a leak from internal research at Meta around IG, Instagram, and the impact on young girls in particular around mental health, suicidality, suicidal thoughts, eating disorders, and that was only discovered through a leak. So I think it's a very interesting parallel, and this is what the lawsuit is about not sharing that kind of information and mitigating that risk.
I mean, you touch on some of it here, but what are some of the other potential health impacts that we know about associated with constantly being on these kinds of social media platforms?
Yeah, Sarah, you know, associated is the right word, and I think the argument that we're going to get back is that you can't prove it's due to the social media exposure, but the associations with mental health problems are quite strong, whether it's depression, anxiety, suicidal thoughts, negative body image, also chronic sleep deprivation from use before bed, also problematic social interactions. It comes from negative interactions on the app, then leads to negative social interactions in real life. So there's lots of different impacts on mental health, but also on behaviors.
Statistics Canada recently released some data related to this, that it found that during the pandemic, teenagers experienced declines in their physical activity, while also seeing a high increase in their screen time. What stood out to you from those findings?
Yeah, this is a study from last week, and they used the Canadian Community Health Survey. So this is a cross-sectional survey that people complete periodically, and they looked at 12 to 17-year-olds. And as you said, screen time and physical activity before pandemic versus during pandemic. And, you know, part of this is very obvious. Their physical activity went down, their screen time went up. But if you followed over time, it was encouraging that there was a recovery in physical activity and some decline in screen time as the pandemic wore on, and they found ways to adapt to that situation. But I think the most important findings, I think two things. One is that even 2 years into the pandemic, the recovery was incomplete. Now, these kids had not gone back to the level of physical activity that they were at before the pandemic, and we're still using their screens more than before the pandemic. And the other piece is that there was a difference between girls and boys. Boys had an easier time recovering, in fact, nearly did completely recover, whereas for girls, there was still a deficit there, particularly with physical activity. So it seems, you know, one of the conclusions is that young girls have been more vulnerable to the effects of the pandemic, at least particularly on their ability to reach those thresholds of physical activity.
So if you're a parent and you feel like your child, your young teenager, is becoming addicted to social media, what do you do?
Yeah, I mean, this is such a common concern now, Sarah. And first of all, what's the definition of that addiction? There's no real definition. But when the child is excessively using it and starting to interfere with functioning in other spheres of their life, that's when it becomes problematic. And the number one thing is limiting time. You've got to leverage features that all of these apps now have. They have to have to be able to limit the amount of time that someone spends on them. For example, on TikTok, you will get a warning at 1 hour if you're under 18. And you would have to enter a passcode to go beyond that. So leveraging those time limits, keep the phone out of the bedroom before bed because of that impact on sleep, turning off notifications so you're not always chasing after things. An extreme example would be removing it from the phone and only interacting with it on a PC, which is much less pleasurable and addictive. And then finding other things to do, IRL activities, in real life activities, new hobbies, or spending time with family. And making that a sort of regimented thing like family dinner where there are no phones at the dinner table so that you're replacing it with something else that's also pleasurable that doesn't involve that social media app.
IRL versus URL. I get what you did there. That was Canada Tonight medical contributor Dr. Samir Gupta. Thank you.